Can you do the surface marking of jugular veins?
Yes, sir, I can do
Both external
jugular vein and
internal
jugular vein.
On this volunteer, you should do.
Yes.
Okay? Nee meeda chestaru, okay kada? Do it. First one, which one you want to do?
Sir, I want to start with external jugular vein. So, external jugular vein is a superficial vein in the body which drains basically the scalp area, the face, the neck and the shoulder. So, it starts with the union of the posterior division of retromandibular vein and the posterior auricular vein, sir.
Where?
It starts at just below, this is the angle of mandible. So, just below the angle of mandible.
So, just below the angle of the mandible by the union of posterior division of retromandibular vein and posterior auricular vein, it is formed.
Starting.
Good.
So, its course is, this is the sternocleidomastoid muscle, sir. It will course just superficially above the sternocleidomastoid. We have to, these are the two heads of sternocleidomastoid. So, we have to trace the posterior border of the sternocleidomastoid just lateral to the posterior border of sternocleidomastoid on the
This one here.
Yes, sir. On the upper border of the clavicle is the second point, sir. So, this is the course. When we join the 2 points, this is the course of the external jugular vein, sir.
Okay, first point is
Just
below the angle of the mandible. Second point is
lateral to the posterior border of
the
sternocleidomastoid.
This is it should come slightly here. Okay.
Yes, sir.
Just lateral to the posterior border of the sternocleidomastoid. So join this. You should like to join from above downwards or below upwards?
Above downwards,
because it is a vein from above downwards. Is it a single line or two parallel lines?
It is two parallel lines. We have to take a width of almost around, sir, 10 millimeter, which is approximately 1 centimeter.
Okay. So that you make it thick now. So that is the course
this is the course of external jugular vein, sir.
Now, okay, internal jugular vein.
So, internal jugular vein is also a vein that will also drain the scalp, the face and the neck region. And it is a continuation of the sigmoid sinus, which is a dural venous sinus, and it comes out through the jugular foramen of the at the base of the skull.
So to locate that
beginning, to locate that, sir, this is the ear lobule, sir. Just medial to the ear lobule is our first point.
First point to the just medial to the ear lobule.
Yes, sir.
This is the beginning of the internal jugular. Ending
is, sir, this is the clavicle bone. It has two ends, sir. This is the medial end, this is the acromial end. So medial end is the second point, sir.
Mark it. So join these two.
So we have to join these 2 points. This is the course of our internal jugular vein, sir.
Okay. This is also single line or 2 lines?
No, this is also 2 lines, sir. It is also approximately around 1.1 centimeter width. We have to take 2 parallel lines, sir.
Okay. This external jugular vein terminates into which vein?
External jugular vein terminates into the subclavian vein, sir.
Internal jugular vein, what happens to it?
It joins with the subclavian vein to form the brachiocephalic vein.
Okay, good. So that only for each vein you have to remember 2 points.
Yes.
For the external jugular vein, below the angle of the mandible.
Yes.
Second point is just posterolateral to the sternocleidomastoid muscle along the superior border of the clavicle.
Yes,
These
sir.
2 points if you join, that is external jugular vein. For the internal jugular vein, it is just on the lobule of the ear and medial angle of the clavicle. If you join these two, that forms the internal jugular vein.
Yes, sir.
Good.